An important part of anyone's plan to stay healthy is their annual wellness visit.
An annual wellness visit is a yearly physical that is provided by your insurance company and even some Medicare insurance plans. The annual wellness visit includes routine blood work, which would include a CBC, a complete chemistry, a urinalysis, a thyroid panel, and a lipid panel. Other parts of the wellness examination include a general health assessment, a check of the blood pressure, a check of your height and weight to get an indication of your body mass index.
Preventive care has suffered due to the COVID-19 pandemic. Whether it was through the stay safe at home recommendations or concern about visiting a physician's office, many people have avoided medical care unless it was an emergency.
Initially, we saw a big drop in patient volumes, up to 75%. Those have picked up, but we're still seeing a drop in volume of approximately 50% of what we normally see. What we're seeing is patients are delaying routine office visits, office care, blood pressure rechecks, diabetes rechecks, and some patients are suffering the consequences of these missed visits. Their blood pressures are not well controlled, their blood sugars are out of control. They're having signs and symptoms of potentially life-threatening problems which they're putting off and not going to their primary care provider for evaluation for.
Telemedicine has grown in popularity in recent months, but many family practice physicians say in-person visits are still important.
We are doing a fair amount of telemedicine. What I'm finding is that it's hard to evaluate patients completely and thoroughly over a video monitor. Sometimes this is appropriate, other times it's not, especially in the elderly, especially with patients with injuries or signs and symptoms of a potentially life-threatening problem. We are changing with the times. Doctors' offices are implementing strategies to keep patients safe. We're limiting the number of people in the waiting room. Everyone is required to wear a mask. If people are sick, if they have fever, we're asking those patients to go to urgent care or possibly even go to the emergency room.
To find a family physician, visit rapidsregional.com.